I'm going to explain right now why in a Medicare Advantage plan, specifically APPO, why do you see two maximum out-of-pockets? Okay, it's a little confusing. In fact, I had an agent who sent me a picture and said, "Hey, Luis, how do I explain this to my insured?" Okay, so first thing I'm going to do is explain to you a PPO. Now, versus an HMO. An HMO, the network is closed. You can only go and see people inside of this network unless there's an emergency. So there's no out-of-network anything unless you have an emergency. And then wherever you go, that facility, because it was an emergency, will be considered in-network. Now, MAPD, PPO, you have the ability to go in-network and out-of-network. If you go inside the network, the plan is richer, which means the insureds pay less. If you go out of network, which is the luxury of the PPO, then the plan is less rich, which means the insured is going to pay more. If they go see a provider, they go to a facility, they receive any kind of medical treatment that is considered out of the network, but at least it's covered. So I'm going to illustrate this on an actual summary of benefits from a carrier. Well, let's take a look. Now, this is Aetna, okay? And this happens with numerous carriers, but some carriers, I looked up United right now, and they're in and their two maximum out of pockets are the same. So this is very specific to the carrier. Okay, so you need to be aware. Now, you'll see here that on the maximum out of pocket, the MOOP, you'll see in network. Let's make this a little larger. You will see in network. You will see 6,350. And then you're going to see a combined MOOP of 9,550. But this is a combination for in and out of network services. Okay, so you must be aware of that. Now, remember I said that in network is richer and out of network is not as rich. Let's take a look at that. Let's say they go to the hospital, inpatient hospital. In the network, they're going to pay $325 per day, days 1 through 5. Day 6 and beyond, they pay $0. If they go to out of network hospital, they're going to pay 40%. It's a big chunk of change there, guys. Huge. Okay. And then we'll kind of, you'll notice here that outpatient, they pay more. Look at the PCP, the primary care doctor. They pay $0 in network, 40% out. 35 for the specialist, 40% out. Okay. Preventative care, they could pay $0, but it could be as high as 40%. Okay. Emergency room is the same. Urgent care is the same. Look at here at diagnostic tests, lab services. Everything is much higher when you go out of network. Also, let's go to dental. You'll notice here on the dental that preventative is $0, but they have to pay over here if it's out of network. Comprehensive, everything else that's not preventative, anywhere between 20 to 50%, over here 50 to 70%. Okay, all right. Now, the good thing is that they'll both, whether they're in and out, they're going to have $2,500 worth of dental. The vision is similar. They'll share a $150, whether it's in or out, but they'll pay more for the exam if they go out of network. So ultimately, guys, the out-of-network benefit is a nice feature of a PPO, but your insured will pay more. I did create a spreadsheet here for you to share with maybe your clients or just for you to remember. Here is the sheet. I'll put this in a PDF for you, but explaining the two MOOPs in a Medicare Advantage plan. So in-network MOOP, they combine in and out of network. Okay. Couple of key points here. In-network protects members from higher out-of-pocket costs when they stay in the network, because those are already pre-negotiated costs with each provider. Okay. Combined MOOP ensures there's a cap when they go out of network. So it's nice, but it's just going to cost them more. I'm trying to think of a scenario here where, why would somebody want to go out of network? let's just say that you have somebody who's got a ton of doctors that they see. They're sick and they're constantly going to all these different docs, and you are having trouble finding an HMO plan that is super rich with all those docs in it. So you go to a PPO plan, and let's say you got some in here and some out, and that's just the only way that an insured can maintain all their doctors. And so you end up going that route, even though it costs them more. But if they want to stay with those doctors, that would be the scenario. All right, that's my explanation on the in-network maximum out of pocket and the combined maximum out of pocket for in and out of network.